Cervical lifting is the plastic surgery that improves the angles of the neck and gives the neck a more attractive appearance. The scar is very small, located just below the chin, and the results are quite long-lasting and consistent. This is our Monday live session, and today I'm going to talk to you about how cervical lifting surgery is done and what the scar from this procedure looks like. I'm Dr. Junie Favrin, a plastic surgeon living in Criciúma, Santa Catarina, and this is our Monday live session. Usually, I end up using a case from Monday as the topic for the live, but today I decided to bring in some questions that came to me on Instagram about cervical lifting surgery. And you know what really caught my attention in the questions? A lot of people were asking, where's the scar from the cervical lift? And for me, at least from a surgeon's perspective, it's really obvious where the scar is. So, for those who don't know yet, this is the scar from the cervical lift that I talk about so much. It's a scar that usually sits right here, under the chin area. We can make it straight or a little more curved. We can follow the submental crease, or we can place it right at the end of the jawbone at the chin. That really depends on the surgeon, whether you're going to do deep neck treatment, address the deeper layers, or remove a gland. So, we adjust the position of the scar a bit. It's usually about 3 to 5 centimeters long. So, it sits more or less in this position, and we approach the platysma muscle. And what's the purpose of this scar, right? It's that when you look at the patient from the front, you can't see the scar because it's hidden in a shadow of the neck. We usually say that the only ones who see this scar are either the husband or the dog because you have to look from below upwards. And that's pretty much what we see, so it stays hidden, right, in a shadow and you don't notice it. So, getting back to the reason, right, the reason for this live. Then I started thinking, right, but why do people ask me about the scar from the neck lift if it's obvious that it stays in that spot? And then I started getting images like these on my Instagram. And that's when I understood why you all ask me so much about the scars. Nowadays, with the widespread popularity of aesthetic procedures, unfortunately, I've been seeing this kind of surgical complication from neck lift surgeries. These are scars from direct platysmaplasty, which is when the person performing the procedure decides to treat the platysma muscle directly. Because normally we make a small incision, lift the skin, and treat the platysma and all the deeper structures through that small scar. So, you need to have the right instruments. You need a fiber optic light. Sometimes I use magnifying glasses. Anyway, it's a delicate procedure. But there is this method, which in my opinion is kind of surreal, trying to treat this area by directly approaching the platysma and removing it right there. My professional opinion is that this kind of, direct approach leaves a lot of after effects. The results aren't as good as what we can achieve, let's say, with the traditional neck lift. And I'll say this, I completely advise against you doing this kind of procedure. I believe that every technique has its indication, but this kind of scar, this approach, is for extremely exceptional cases, maybe for tumor removal or dealing with a disease. But under no circumstances should this be considered a cosmetic surgery. That's my opinion, that's my stance. And thanks to you all, I started to understand why. Sometimes I get this kind of patient in my office and I don't really understand what they tried to do. And then, talking with the patient, seeing the after effects that show up, I try to help them in the best way I can. So, what I recommend as a specialist for anyone going through this problem, if you're one of those people who sent me photos like this in my DMs, don't touch it and wait a year for the healing process to settle so that the fibrosis, the scars, and even the platysma muscle itself can reorganize. And after a year, I recommend that you get a dermatological ultrasound to assess the condition of the muscle. I've already had to re-examine patients with this type of complication, and usually the muscle isn't properly healed because normally we see the platysma bands, and after the patient has surgery, they're sutured together in the middle. With this type of complication, usually the platysma has kind of been avulsed, and we can't really give that continuity to the muscle. This really affects the final result of the procedure and its longevity. So, wait a year before you try to address the complication. Always get a dermatological ultrasound so your doctor can be more precise, right? And so you have a real expectation of what can actually be improved in the complication. And only have surgery with someone who truly understands face and neck lifting surgery. So, do a lot of research, read a lot, try to understand the procedure a bit, because there are complications that can be improved, but sometimes the damage is irreversible, okay? So if I manage to get this message across to you in today's live, then the time I spent here was already worth it. And now I'm going to start answering some specific questions, right, from those who sent me messages here on Instagram. Yeah. So first, the scar, right? I've already explained. It's very small and it's under the chin. This scar here is used to reorganize the anatomy and to do the debulking, to do, well, the removal of these deep structures in the neck, gland, muscle, fat, whatever we need to work on. And then, when we need to create that lateral contour, we need an incision. This incision can be made behind the ear or along the front hairline. And it repositions the platysma. It creates that lateral pull so that the platysma, hugs the neck and creates the contour. When the patient has loose skin in this area, a scar around the ear is necessary because somewhere we'll have to remove the excess skin. So, the skin scar isn't for performing the surgery itself. The scar on the skin is to remove the excess skin. Access to the structures can be done with smaller scars, but if the patient has sagging, remember, if there is sagging, we'll have to make a slightly larger incision, usually that incision around the ear, because there's no way for us to just make that skin disappear. Another complication that sometimes shows up for me is complications from thread lifts. These are patients in their 50s, around 55 years old, who have used thread lifts. They end up with a dimple at the point where the thread was anchored and with excess skin behind it. So either you release the thread lift or you do a mini lift to remove the excess skin. So, skin laxity means incision. There's no other way to do it. There's no way to just make that skin disappear, okay? That's another message I want to leave here in today's live as well. Guys, this live was really great. Next Monday, I'll bring up another topic. If you want to make suggestions, you can send them to me via direct message. I always curate the main questions, just like I did today. Big kiss, have a great week, and see you next Monday.